Assalamu alaikum and welcome to the Dr. UUT channel. In this video, we will talk about the cardiac failure, heart failure, or congestive heart failure. This lecture is available in Urdu. Now we'll commence the lecture in English. Heart failure. What is the function of heart? Pumping. When this pumping mechanism becomes weak, we call it as heart failure. What are the reasons behind to weak the pumping action of the heart? Myocardial infarction, arteriosclerosis, arrhythmia, hypertension means high blood pressure, and etc. These all are actually the causes of the cardiac failure. So what happens when the pumping action decreases? The cardiac output, the physiological term is cardiac output, it actually decreases. When the cardiac output decreases, what happens? The tissue perfusion decreases. Means there will be not that much blood supplied towards the tissues. So the tissues need the blood. Now the blood supply is less due to the weak pumping action of the heart. So like this, what will happen? Where two systems in the body will activate. One is called the sympathetic nervous system, another one is called the RAS system. By these two systems, the heart will regain the normal cardiac output. What is the mechanism through which it is regaining the cardiac output? Well, the sympathetic nervous system. First of all, when the cardiac output is decreased, so the ventricles will pump the blood of low concentration. That will reach the carotid sinuses in aortic arch or aortic arc, where there are the baroreceptors. Now this blood is of low concentration and of low pressure. These pressure sensitive receptors will sense the blood, and then these receptors will send the signal to the sympathetic nervous system that the blood concentration is decreased. So you have to increase the concentration by increasing the heart job. So what will happen then? Then the sympathetic nervous system will start activating itself on the heart, on the blood vessels, mainly arterioles, and on the kidney. We have the sympathetic supply on the sinoatrial node, SAN. So increased activity on the sympathetic nervous system will increase the heart rate, and we have the supply of sympathetic nervous system on the ventricles. So the increased sympathetic activity on the ventricles will increase the contraction of the ventricles. So like this, when the heart rate is increased, the ventricular contraction is increased, a kind of output of the blood will be increased. We can say that cardiac output is somehow increased. And the second side, that is on the arterioles. The sympathetic supply will constrict the arterioles, due to which what will happen? This arteriolar constriction will increase the blood pressure. Physiologically, we will say that this will increase the afterload, the load or the pressure on the ventricles. So like this, the ventricles will receive more stress. So actually, the sympathetic nervous system is giving the stressful supplies to the heart in order to increase the stress on the heart. When the stress on the heart increases, the heart will start contracting and relaxing in a strong way. So once again, we can say that cardiac output is somehow increased. And the third supply is on the kidneys. The sympathetic supply on the kidneys will increase the release of the renin. The kidney also releases the renin. So now we got two ways of releasing of the renin. One is through the sympathetic activation, another is through less perfusion to the kidney itself. So now both will combine together and will start releasing of the renin. Now this released renin, we studied in the RAS system that renin is responsible to produce the angiotensin 2. And this angiotensin 2 has got now three jobs to increase the cardiac output. One is on the adrenal gland, that is by releasing the aldosterone. Another one is on the antidiuretic hormone, and the third one is on the arterioles. Coming to the first one, when it acts on the adrenal gland, it will release the aldosterone, and by means of aldosterone, we know that its action is on the nephron. It will cause the reabsorption of the salt in water. Like this, when the salt and water comes back to the blood vessel, so the blood plus salt plus water will increase the concentration of the blood. You can say blood volume will increase, and when the blood volume increases, there will be increased supply of the blood back towards the atria, then to the ventricles. Like this, there will be a kind of increased venous return, we can say, which will also increase a kind of stress on the ventricles to stretch and to contract again back to pump the blood out. So it is also kind of acting in increasing the stress on the heart. And we have the next, that is on the antidiuretic hormone in the pituitary glands. So now this antidiuretic hormone, again we know the job of the antidiuretic hormone is on the nephron. It also reabsorbs the sodium and water, means salts and water. Now again the blood volume will increase, again the venous return will increase, again the ventricles will get the stress, and the heart is responsible to give the reply of the stress in the form of contraction. Then the ventricles will contract, like this output is again increased. And the third one we have, that is on the arterioles. Angiotensin, the name is telling itself also. Angio means blood vessel, tensin means tension. So these are actually increasing the tension on the blood vessels like arterioles. When this tension increases, it again, I told you before, it is increasing the blood pressure. Arterioles, when arterioles are constricted, they will increase the blood pressure, and the increased blood pressure will increase the afterload. Then the ventricles again will receive a kind of stress, and the ventricles are responsible to give the reply to the stress by means of the contraction. Now again the ventricles will contract to pump the blood again out. Like this the cardiac output will increase by two ways, by means of the sympathetic activation, by means of the RAS system. When time and again these systems are activating or bringing the cardiac output back to the normal, they're actually increasing the heart rate. They're actually increasing the contraction of the heart. Afterload, preload, means they are bringing the heart into stress time and again. Now this stressful situation may remodel the shape of the heart. Now this cardiac remodeling may happen, due to which then more worse condition may happen to the cardiac failure. So before the cardiac failure worsens or aggravates, we'll go for the pharmacology, through which we will help the patient to maintain the normal function of the heart. Like this will decrease the activity of the heart. The very first class, angiotensin converting enzyme inhibitors, like captopril, enalapril, means they're having the pril in the last. So these drugs are actually blocking the angiotensin converting enzyme. If we block this enzyme, what is going to happen? The angiotensin 2 will not be produced, and if they are not produced, so their action on the adrenal gland, on the antidiuretic hormone, and on the arterioles is decreased. They were responsible to increase the blood volume. Aldosterone antidiuretic hormone, they are supposed to reabsorb the water and salt into the blood vessel. What will happen in the blood vessels? The concentration of the fluid will increase. You can say the blood volume will increase, and due to which what will happen? There will be increase of the venous return. When we block angiotensin converting enzymes, they will not produce angiotensin 2, and there will be no production of the aldosterone, and there will be no production of the antidiuretic hormone. You can say that then there will be no increment in the blood volume. So blood volume will be reduced. As the blood volume gets reduced, there will be reduce of the venous return, or you can say there will be reduce of the preload. Like this, what will happen? The ACE inhibitors will actually help in reducing the stress on the heart. And we have another class that is called as Arbs, angiotensin receptor blockers. Their mechanism of action is just like of the angiotensin converting enzyme, but they are specific on the receptors of the angiotensin. Now angiotensin 2 is responsible to activate the adrenal gland to release the aldosterone. Now here the receptors are available for this angiotensin 2, and we have on the antidiuretic hormone also, and we have here also the receptors for the angiotensin 2. So what will we do now? If the patient is complaining of the dry cough and of the edema, then we will give that patient these medications in order to replace the ACE with the Arbs, in order to avoid the side effects of the ACE. So what will these do? They will actually target the receptors, and rest of the mechanism is the same. Means they will decrease the venous return, they will decrease the preload. Like this, a stress will be reduced on the heart. And example of the drugs are valsartan, telmisartan, olbisartan, etc. Means sartan actually mention the Arbs. And we have the next class, that is of the aldosterone antagonist, like spironolactone, eplerenone. Aldosterone antagonists will act on the aldosterone receptors, and you know that they were responsible to do the reabsorption of the water, and somehow they are actually helping us in the potassium maintenance level also. Well, we'll come to the point, that to this specific point, that aldosterone antagonists are actually helping us to reduce again the venous return And they will also, again, if the venous return is decreased, you can say that the preload is decreased on the heart. When the preload is decreased on the heart, so you can say that that stress is a bit decreased. We're actually decreasing the stress on the heart. We have another drug that is called the beta blockers, like carvedilol, metoprolol, and etc. These medications are doing, actually they're blocking the beta receptors on the heart. We have on the SAN, we have on the ventricles. So when the SAN and ventricles receptors are blocked, like this, the heart rate will be decreased due to the SAN receptor blockage, and the receptors of the on the myocardial cells, contractile cells, when they are blocked, then the contraction of the heart will be reduced. So by means of beta blockers, we are actually decreasing the heart rate, decreasing the contraction. Like this, you can say we are decreasing the stress on the heart. So in a sense, we also need somehow a little bit contraction also, but for that we will go for the inotropic drugs. These drugs like digoxin, they will help us in doing the proper contraction. So digoxin are actually increasing the strength of the heart, not the heart rate. We have discussed the digoxin's mechanism of action in a very detailed way, by the way. So these drugs are used in order to maintain the contraction, the proper contraction. So beta blockers are actually decreasing, and digoxin is actually increasing just the contraction, not the heart rate. So we need a proper contraction to pump the blood outside. So like this, the beta blockers are also helping us to reduce the pressure or the stress on the heart. And we have the next one that is called diuretics. You can imagine from the name, dia means to increase or to go through, diuretics means urination. They are actually increasing the urination. Like this, the blood volume will be decreased. When the blood volume is decreased, they are actually decreasing the venous return, and they are also decreasing the preload on the heart. And like this, the stress on the heart is a bit maintained. By the way, these diuretics are actually indicated to those patients, those who have edema, either peripheral or pulmonary edema. Like this, they will bring those tissue fluids to the blood vessels, and like this, these fluid will be then moved out through the urination process, and the blood volume will decrease, and those edemic conditions may become normal. And we have the next one that is called is the direct vasodilators. We have vessels like arteries and veins. So they will also dilate the blood vessels. If we dilate the arteries, for that we have the drug hydralazine, and for the veins we have the drug nitrates. So by dilating the arteries, we are actually decreasing the blood pressure, and we are decreasing the outer load. And by dilating the veins, we are decreasing the venous return to the heart, or you can say we are decreasing the preload. So when we decrease the preload and afterload on the heart, like this, we are actually decreasing the stress on the heart. So what we mean is that we are supposed to decrease the stress on the heart, or to bring the heart into a normal state. So like this, these medications are helping us to decrease the stress on the heart, and the work on the heart will be decreased. As the work on the heart decreases, then those chances of cardiac remodeling may decrease. So this is the pharmacology that is helping us to reduce the cardiac failure. Hope so you got. If still you have any kind of question, you can drop that in the comment box. We'll come for the answers very soon. Thank you for watching.